I am Dennis Longmire. I've got to look at these notes to make sure I know who I am. I'm Dennis Longmire, and I'm chair of this year's Beto Chair Committee. And my primary purpose this morning is to introduce the person who is going to introduce our guest lecturer. I also want to remind everyone to please turn your cell phones, pagers, and everything on silent or off, whichever suits your purposes. Also, if you will, please hold your questions until after the lecturer has finished, after Dr. MacKenzie has finished, unless she overrides that. She's the person who controls that. Also, to remind all of the doctoral students that immediately following this, there will be an informal colloquium with Dr. MacKenzie in the flag room. There are also some criminal justice agency people who are attending today's lecture. I want to welcome you especially and let you know that you are also welcome to attend the informal colloquium with our doctoral students in the flag room when this concludes. And then after the colloquium, at about 12 o'clock, there will be a lunch also available for graduate students and agency people and anybody else who sneaks in. There will be a sign-in sheet. Just sign a name and make it real illegible. Well, we don't know who it was. And the dean will pay for it all, so he's not here. I can't get in too much trouble. But I do also want to let you know that this actually is the 30th year celebration for the Beto Chair Lecture Series. The actual Beto Chair Lecture Series is funded by a private philanthropic organization in Houston called the Houston Endowment Incorporated. It's actually the Jesse H. Jones and Mary Gibbs Jones Endowment Corporation, also known as the Houston Endowment. And back in 1979, they donated a fairly large sum of money specifically for the purpose of bringing scholars in who could engage in interaction with our doctoral students who were pursuing advanced studies in criminology and criminal justice. And so I want to also acknowledge and thank the Houston Endowment Incorporated for the gift that's allowing us to bring this lecture series to life. With that said, I want to remind the doctoral students that there will be another lecture series this semester. We will be visited by Dr. Nicholas Lovert from Washington State University on November 19th, so put that in your calendar. And also Dr. James Jacobs from New York University School of Law will be coming on February 9th. So we'll start our spring series off in February, and we're planning another one for later in the spring semester, so everybody needs to watch their calendars. With that said, let me introduce Dr. Jaylene Armstrong, who will introduce Dr. MacKenzie.
It's my distinct pleasure to welcome all of you this morning and introduce a very special guest to me, Dr. Doris MacKenzie. She is my former mentor and now friend. So it's a pleasure to tell you a little bit about her background. She's currently at the Penn State University, newly there as of this year, and she is the director of what is the Justice Center for Research at Penn State University. By training, Doris is a psychologist, but she spent most of her career within criminal justice departments. She was a visiting scholar at the National Institute of Justice and spent a number of years advancing to the full professor level at the University of Maryland, which we all know is one of the best programs in the country next to San Houston. Graduated from there. Doris has done a lot to advance the field within corrections, both within her research, teaching, and mentoring students. I had an opportunity to respond to the email this summer from someone who was nominating her of how many students she mentored over her career. And when you start listing all the different students that she's mentored, and then you read some of those top scholar articles, she's actually mentored more than half of those students who come from the University of Maryland. So she's doing something right there. And maybe not dissertation chair, but some way, shape, or form she's been involved as a professor or they've worked on her projects or something like that. So she's doing something right with her teaching. Within the field, she's established and was the founder of the Division of Sentencing and Corrections within ASC, which has really come to fruition. She also played a pivotal role in getting the Academy of Experimental Criminology going within ASC, which really encourages experimental research within criminal justice, which we know is just growing now. She served on the ASC Executive Board and has also been recognized for her service to ASC. Within her research, her primary focus is corrections and offender behavior. probably first became most famous for her work at the adult level with boot camps when they had their heyday, and then subsequently the juvenile boot camps where we tracked all over the country, and has really been an expert in that area. She's since moved on to do a lot of the on-the-edge work with the evidence-based corrections movement. She's really done a lot to encourage that knowledge within the practitioner community, but also internationally. She founded the International Prison Initiative. She's been in China as a Fulbright scholar and continues to teach in China. Just done all kinds of things. Also, if you've heard of the Maryland Report, Doris is also one of the co-authors of the Maryland Report, what's working, what's not. And that has led to some of the work she's going to present today in her talk of what's working in corrections. But she was also listed as part of President Coleman's address to ASC in her presidential address, named as one of those people who saved rehabilitation. So her talk today is bringing all of that together. What works in corrections, education for reentry and rehabilitation planning. And I'd like to welcome you and thank you for joining us.
Thank you for that really nice introduction. It makes me feel wonderful. And I'm really happy and honored to be here. It's really an honor to be here and visit, and also to know that there are people here from probation and corrections who are interested in what I have to say also, along with graduate students, which that's been a really joy of my career, is mentoring, and I didn't know I'd mentored that many, but that is a joy of being a professor. But what I want to talk about today is some work that I've been doing on what works. It grew out of the Crime Prevention Report, and I'll go over a little bit about the Crime Prevention Report. As far as the introduction, if you have questions that you think need to be clarified we'll have plenty of time for questions after I finish, but if I'm not clear on something, I'm perfectly comfortable with you raising your hand and asking me to discuss it or explain it. So feel free there. What I'm going to be doing, let's see if I can get this to work. Do I point it? Well, I'll do this. Do that. All right, what I'm going to be doing is talking a bit about some work I pulled together in this book, What Works in Corrections, Reducing the Criminal Activities of Offenders and Delinquents. It grew out of a report, the Crime Prevention Report. I started out doing a systematic review that was really using a scoring method to look at both the outcomes, the significance of outcomes, but also the quality of the science, and then moved into doing meta-analyses. So I'll be talking, that's kind of the focus of the talk. I'll start out with a little bit about corrections in the US. I'll go quickly through that because most of you are very familiar with what's been going on. Then talk about the methods for determining what works, how I made decisions about effective programs, a theory looking at the results. I really looked to a kind of need for a cognitive transformation, and I'll talk a bit about that, and the implication for the rapidly developing reentry programs, and a little bit about future needs and new developments. So the US has a major problem. Of course, we have 25% of the world's prison population, over 2 million in prisons and jails. A large number of these are released. When we look at the time from 1930 until about 1975, we see a very consistent incarceration rate. This is per 100,000 in the population. And then all of a sudden this dramatic increase here, which has created a problem. Many of the people that have investigated this large incarceration impact have determined that it's really a philosophical change, and that we made in the 1970s that led to this change in the incarceration rate. And of course, there's lots of debate about that, but really one of the examples is what Nothing Works, from Martinson's article when he reviewed correctional programs and said nothing works. That started a series of changes in the system that led us to more of a incapacitation and deterrence focus, a law and order, which ended up changing policies and having a large impact on this. People have said, oh, it was an increase in crime, and yet when you look at the data, a paper by Blumstein and colleagues really looks at a large percent of this is due to philosophical changes. But so essentially, this I think is a good cartoon to reflect that. It says mandatory majored sentences for minor drug use, and then in quotes, the man holding the war on drugs sign talking to another man, sure, we keep losing, but look at all the prisoners we're taking. So we keep increasing, but are we succeeding? What I'm arguing here is that one of the things that we should seriously consider is moving into using science to help us make decisions about effective correctional programming, and that presented in a form that's usable to policymakers. So that's really been a goal of this work that started with the Crime Prevention Report. So I want to talk about, first of all, a little bit about the Crime Prevention Report, for those of you who are not aware of it, in which we developed a system for identifying both the quality of the science. So what was happening is many times the policymakers invite people in to talk about programs, and many times when I went in to testify before a congressional committee or to talk with policymakers about boot camps, I would end up with also a program person. And the program person would say, this is extremely effective program, we know it's effective, and they might give some outcomes, recidivism outcomes from their program. But as far as designing really strong research to examine that question, they didn't have that. And the policymakers then were somewhat confused of, well, you're telling me it's very effective, but here's the scientist is saying it's not. And so really our attempt here in the Crime Prevention Report was to judge the science in a way that could be used by make sense to policymakers. And also to make it very open about how we made those decisions. So the Crime Prevention Report was requested by US Congress. They wanted a comprehensive evaluation of all crime prevention programs. They had felt they had put in a lot of money into crime prevention, and they wanted to know if it was working. Has this money been used effectively? And so we ended up completing a report. We had a very short time period to report on what works, what doesn't, and what's promising. Mostly faculty at the University of Maryland worked together on this report. What we did was to develop 7 different settings of crime prevention. So we were interested in all areas of crime prevention, taking a very broad perspective, much broader than the usual definitions for crime prevention. Often we think of it as preventing crime before somebody gets involved. And some of the areas did work with that, certainly family programs. But in other areas, we felt it was also taking steps that reduced crime in the community. And in this case, I worked on courts and corrections, where I was interested in programs, interventions that would reduce the offending of those who have already been identified as criminal. So it's taking a broader definition of crime prevention. So I was interested in reducing crime in the community, and correctional programs or court programs like drug courts that would reduce crime in the community. I focused on recidivism, and many people, particularly those coming out of a psychological background, are interested in broader issues. In other words, antisocial attitudes are strongly correlated with recidivism. And then, so the question has been asked, why didn't you look at those and when you're judging effectiveness? Also, of course, there's other areas of the offenders' lives, like did they get employment? What was the cost of the program? Were outcomes in employment? Well, they were earning money, so the cost was reduced. So you could do cost-benefit analysis. But I really saw that if we could be clear on recidivism, then we could start asking questions about other issues. Certainly costs are an important issue for policymakers, but they're usually combining that with an interest in a reduction in criminal activities. And so if we keep those separate and someone else can do the costs, an economist can do the costs, I want to look at, are we having an impact on recidivism and the criminal activities of known offenders and delinquents? So what we did was, for this report, in these different areas, we came up with a method for assessing what works. And we wanted to classify programs as what works, what's promising, what doesn't work, and what we don't know. So we wanted to come up with a method for classifying programs in those areas. It was a two-stage assessment, and I'll give an example now. At stage 1, we were interested in assessing scientific quality and the significance and directions of the results. At stage 2, we wanted to examine a whole group of studies. So then, how did we make that assessment for the quality of the science? We came up with a 5-point scale. 1 is too low to even consider. And then we had level 2, 3, 4, and 5, with 5 being a gold standard randomized trial. And if you just wonder about the importance of this for corrections and looking at science this way and trying to evaluate it, think if you, or many of you have had friends or relatives that have had cancer, they want to decide about chemotherapy and what treatment they should get. If it wasn't a randomized trial, if you didn't know that it was really strong research, and science in medicine has really been moving strongly in this direction, you really want to know that it's a 5, that they did scientific tests of the effectiveness of this medicine, and the science was really well done. The strongest research design, the gold standard. So this is what we did. For each study then, we're trying to read the study and assess what's the quality of the research. So, and this happens many times in drug treatment, for instance. We read through a study and we say, oh, they compared dropouts from the program to those who completed. Very poor scientific design. There's some level of association, but those groups were different before they started the program. So it really isn't telling you about the impact of the program. And that's really the reason for assessing the quality. All right, so now just to give you an example, when I'm talking about programs, I say programs and interventions because if you're coming from a psychological point of view or social work counseling, or you're looking at programs, you might be thinking rehabilitation programs. But there are also interventions, like drug courts has a component of rehabilitation, but it's an intervention that's broader than just the drug treatment. So by programs, I'm talking programs, strategies, interventions. And a drug court is one example. So at stage 1, we're going to take each study we can find, everybody that did a study, and we're going to say that particular study, how strong was the research design? In this case, it was a randomized trial. And then we ask, all right, what's the experimental group, the people that went to the drug court, and compared to the recidivism of the control, and is it significantly different? So there's one study, an example of a strong research design where there is a significant difference. And the other thing that we think was really strong in our decision was always to publish the reference for the study. So anybody else can go in and find that study and read that study and say, no, we don't agree with your scoring. Or they can look at the work we did. So that's stage one. Stage two then was to look at the group of studies, and today there are many more studies. In fact, we were thinking of doing a meta-analysis of the drug courts. There are many more studies. I just used this as an example. So for each study, we have the assessment of the quality of the science, and then whether or not there were significant differences. We use that information now to classify the programs, drug courts, into whether or not they were effective. And for what works, the decision was if there were 2 studies with a research method score of 3 or above, 2s were scientifically too poor to use in this decision, and then also showing a significantly difference between the experimental and control group, with the experimental or the drug court group having lower recidivism. So that would classify something as what works. And we had decision rules then for each one, what's promising, what doesn't work. That is then one way of making decisions about what works that I used for the programs I'm going to talk about. So I really want to go through how I made the decisions, trying to justify this is how I made decisions about what works. Then I'll talk about the specific programs. In this case, then, the 3 studies with research methods of 3 or above and significant difference. So it would have been judged to be effective. And we classify them in one of these areas. All right, the second area that I used, then after we did this work, I became interested in the technique, a statistical technique called meta-analysis, which is actually using the studies, the outcomes from the studies, in a statistical analysis. And I'll go a little bit through an example of meta-analysis. Some of the meta-analysis have been used to come up with general principles of the types of programs that are effective. But what I was interested in was really looking at specific programs, boot camps, drug courts, drug treatment in prison, work programs. So each one of those different areas. And so essentially I wanted to do more targeted assessments, looking at educational programs, intensive supervision, every category of programs or interventions that I could find with enough research to do a systematic review or meta-analysis. And I'll give an example of a meta-analysis here. Go through it just so you get an idea. And then I'll also refer you to the Campbell Collaboration website and tell you about that in a moment at the end of my talk. But here's a meta-analysis example. What you're trying to do is find every study and review that study to find out if it has the characteristics of eligibility that you need, that you want in order to be able to do this statistical test. We did a meta-analysis with correctional boot camps. We identified 771 documents that we had to read. We had to locate abstracts, read, and say, is this potentially, is there a comparison group? Did they do recidivism as an outcome? So they would qualify if they had those characteristics. We found 152 that were potentially relevant. We located 144, some we couldn't locate. We had 29 eligible studies, but in there were independent samples. So in other words, in one study, a study that I had done on boot camps, we studied Louisiana, New York, and Georgia. So that would be 3 different independent comparisons, each with comparison groups within the state. So we ended up with 14 juvenile and 27 studies that were eligible for the meta-analysis. Then what you do is take each study and carefully code the details of the study about the methods that were used, the participant characteristics. In here you want to know, all right, if the boot camps had women in the program, were the results different than if they had men or girls? Was it more or less effective for different types of participants? And then also program characteristics. Were boot camps with treatment philosophy more effective than those that didn't include treatment philosophy? You're looking at effect sizes as the outcome. And the way to think about this is really the difference in recidivism. It's standardized for the numbers of people in the study, but it's really the difference between the recidivism outcome. That's the way to think about it as far as. So you're looking at the outcome is how much different was the recidivism. And it's a quantitative statistical analysis. All right, this, I know this is hard to see. It's a picture of the results. And so essentially, it's a forest plot. These are all the studies, the individual studies. If the diamond is on this side, it means favors the boot camp. The boot camp's recidivism was lower. If the diamond is on this side, it means the boot camp's recidivism was higher. The line is the central tendency. If it goes over the middle line here, then there's no significant difference. So if you just stand back and look at this, how many diamonds are on the right, how many diamonds are on the left, and how many lines cross the middle, you see it's about split, and most of the lines go across. So overall, no significant differences in outcomes, in recidivism. If you look at all these studies, use it in an analysis, it means boot camps don't do better or worse than the comparisons. And I wanted to show you then an example where you can see there a big difference. This is in-prison drug treatment. Drug treatment provided in prison. Outcome is still recidivism. Over here favors the treatment, the diamonds. Over there, very small number favor the comparison. Many more lines don't cross the center. And so in this case, there's a significant difference. So if you're talking about effectiveness, boot camp's not effective in reducing recidivism. In-prison drug treatment, effective in reducing recidivism. So essentially, those are the 2 methods that I use to make decisions about what works. And as I said before, I'm looking at strategies, I'm looking at rehabilitation, human service programs, different types of offenders, programs for sex offenders, for instance, substance abusers, and then control and discipline programs like boot camps, electronic monitoring. And so this is where we get to that was to tell you how I made these decisions and to justify that. So what I'm saying is I used these very transparent methods so you can go to how I made those decisions and say, I disagree because you should have done this in your analysis, or you should have classified programs as working with, they had better, more scientific evidence. So everything is transparent. But then I wanted to say, all right, now we've got results from all these areas, and the bold areas are ones that, and with the star, are the ones that I found significant. So you can see adult education, vocational education, cognitive behavioral. This sometimes gets mixed up between cognitive behavioral skills treatment and cognitive behavioral therapy provided by trained psychologists. Most of these programs given in corrections are skill-based programs given by lay people. So they're not necessarily trained psychologists that are, although they could be, but they're very ordered, consistently structured programs. So I'll go on with the other interventions. I found cognitive behavioral relapse prevention, behavioral, hormonal, were all for sex offender treatment, but not the psychosocial, the more of the counseling with the psychodynamic perspective. And in this case, the cognitive behavior and relapse prevention and behavioral may be given by more. They are not the structured skills programs that the earlier cognitive behavioral were. These are often delivered by more trained personnel. Then other interventions, domestic violence, not finding the programs effective. Drug courts, yes. Community outpatient drug treatment and incarceration-based drug treatment. Boot camps, no. I'll summarize this in a minute. I just want you to see the range. And then of all of these, and you can see some of them have very small numbers of programs. Multisystemic therapy, a treatment for juveniles to keep violent juveniles in the community, and multi means all systems. They work with the schools, the families. Okay, so what works? And just to update you on this, so we've done meta-analysis and the decision-making. These programs appear to be effective. As I said, that was some of the sex offender treatment. Then some of this has been followed up in the Campbell collaboration, which I'll describe a bit later. And there's meta-analysis using even larger samples than I had at the time. And the results are, one of the results is more of a questioning of the multisystemic therapy. The reason that I say this is it's an updated meta-analysis and it's on the website. And because this program, for those of you that work with juveniles, you've heard so much about this program. The original work, of course, the research was done by the people developing the program. The new meta-analysis does question whether it's really having a significant impact on the juveniles. And I just want to, so my results at the time that I did it, with the studies that I found, it looked to be effective. I concluded it was. This new meta-analysis questions that, so you should be aware. Then unknown evidence on these I did not find to be effective. So there wasn't in the meta-analysis. And I think one of the things is I want to point out is the work, multi-component work and employment programs. There is another update on that, and that's consistent with this. It's on the on the Campbell website. It's talking about work programs, and it becomes important as we start to talk about reentry here in a moment, that the multi-component and different types of employment programs, they did not find to be effective in reducing recidivism. And so it's consistent with my findings. All right, and so what I did then, after having these lists, I tried to step back. It's really working from a kind of inductive, that I looked at the results and said, okay, now why these results? Is there anything consistent that I would find? And I guess one of the things is that there were a group of programs that were not effective, that really didn't have a strong theoretical basis, or they really had an outdated theoretical basis. And that may explain why some programs were not found to be effective. Others, and this is really important, others were really focusing on punishment, deterrence, and control. So these programs were particularly popular in the 70s and 80s, when our philosophy for law enforcement and control of offenders, we felt if we had a deterrence-based system, a lot of times. Nothing works in rehabilitation, according to Martinson. I'm, of course, disagreeing with that now with these results, but that Martinson, back in the 70s, published this review where he says nothing works, Martinson and his colleagues, where he says nothing works. We begin to start to have that philosophy as you went out in the 70s and 80s and talked with people in corrections. A lot of people would say, well, nothing works in corrections. And so they really started to explore a deterrence model. We can't rehab them. Let's deter them, let's incapacitate them by locking them up or keeping a lot of control over them, intensively supervising them in the community. Or let's try to deter them by making the punishment onerous, like the boot camps. The beginning boot camps were very strict, rigorous, did not have a treatment perspective, or electronic monitoring. So if these programs are used to control and incapacitate, if you lock people up, they're not out there committing crimes. That's incapacitation. Maybe that's effective, but that we could go into all that literature. But the thing is, it's there, if you're looking at it to reduce recidivism, these programs did not have that effect. And there's fairly strong research on boot camps and intensive supervision that supports that perspective. A fair number of studies, because they were so popular, federal dollars went into studies of the both areas. All right, now my argument is, after looking at the studies and saying what's effective, is that it seems to be we need to human service kinds of programs, therapeutic programs that bring about a change in the individual. And it's what I've been calling cognitive transformation, in agreement with some other researchers who have used that term, that you actually need to create a cognitive change within the individual before they can go out there and take advantage of opportunities in the environment. So, and it has direct implications for what we do with our programming, particularly reentry. So in criminological theory, a lot of times we talk about environmental opportunities, attachments or bonds. And we know that when people are married, when people are working, they commit fewer crimes. So there is an association. And this, Sampson and Lobbs have done a lot of work in this area. But what is the mechanism for change is my question in this theory. The social environment has to be conducive to change, but there's kind of a fortuitousness of why somebody would go to work, show up at work. I mean, that's a part. You have to get up in the morning, you have to decide that you want to show up. So my question is, this type of theory doesn't really explain how you create that individual change. If you're going to have fortuitous events or you think marriage is good, then maybe at the end of the prison sentences, we should have big parties and invite a lot of nice women to meet the men, and hey, they'll meet nice women, they'll get married, we won't have a problem. Maybe it would be the social climate, but it doesn't seem like it really explains why we are creating changes. So this individual transformation really is consistent with, Giordano proposed this in her work with juveniles, talking about the cognitive transformation. Cullen and Gendreau and the other Canadian researchers would talk about attitude change and that we have to create a change within the individual. It's also consistent with Shad Maruna's work when interviews with offenders, where he talks about self-agency, but I'm not sure that he would take the position that we can create that difference. He was really talking more about they have to make that change. What I'm arguing is our programs appear to, that we have programs that can indeed transform individuals so that they're willing to be drug-free. They're willing to, their attitudes towards other people change, and that that's really what we need to do. So, implication for reentry programs, there's a lot of interest in reentry programs. I visited one yesterday, Savoy, is that? Savory, for the violent offenders. And we have a large number coming out every year. There's money being put into these programs. We know the offenders have a terrible time trying to reintegrate into the community. And I think there's some implications for this research, but I have to show you this. I think we have traditionally, before this emphasis on reentry, had a simple solution to a complex problem. The problem, prison recidivism, is essentially we're booting them out and saying, and don't come back. Well, I think there seems to be a move towards saying, I guess we should do something. And I want that, I guess we should do something to move into, all right, that something, what should that something look like? And I think this research suggests that maybe our temptation to focus on housing, reunited families, employment on the outside is not enough, that we can give them a chance to look for jobs, we can help them find a job, we can help. That doesn't mean they're going to get up in the morning and go to that job. That doesn't mean that the night before they're not going to use drugs and sleep through the time they should have gotten up. And so I see a development and emphasis in our reentry programs on developing this kind of emphasis on, oh, we'll get them back with their families. Well, a lot of times their families don't particularly want them. And if they haven't changed in their attitudes of ways to treat their family, their children, their spouse, their parents, that relationship isn't going to be very good. So I'm really, I guess, interested in emphasizing that we really need to do something to bring about that change before, and that we can do that. We have programs that make those, that can bring about those changes, and unless we do that, and that's why I was so interested in the reentry program yesterday. It really was a program that worked on their thinking as far as I learned about it, that it really started to work on their thinking about what they were going to do in the future and making changes in their willingness to act differently. And I think this research is what I'm saying. My examination then of what works really points us in this direction. But a little bit about some of our what works future research needs. We really need doing these meta-analyses. I think they're very good ways to summarize the work that's out there, both the method scoring and the meta-analyses. But what happens is what people put in the research articles often don't have enough detail of the implementation of the programs. So that we want to study boot camps, and they're studying boot camps, and boot camps work better than this other facility. Well, we often don't have the details. I mean, when you go through the research, you can't even find out if there are women and men in the program. You can't find out the race distribution. There's just such limited information given in the research articles that it's very hard to do the detailed analysis. So we really need to try to improve the information that we put out in research studies and look at the components of both the program and also details about the participants, like boot camps, how much was their daily schedule focused on drug treatment and attitude change and this type of behavior. And then improving the quality of the research. When I looked at this research, the studies that I examined, only 14.8% were randomized trials. 23.2% scored a 2, which is what I said was so low, you couldn't even count it in making decisions. So I think that the quality of our research really needs to be increased. And there are some areas that are particularly problematic. For instance, in drug treatment, academic education, cognitive behavioral for sex offenders, and drug treatment in facilities, a lot of those studies that we found were scored as a 2, which means that, and often this happened, somebody's funding these studies and not requiring that they do a high-level evaluation. I was talking to the people here, I was really impressed to hear the strong relationship that the researchers here have with the different justice agencies and their willingness to consider strong research designs and randomized trials. You should feel very positive about that. So one of the things that I wanted to do at the end, if we have a few minutes, is to just talk about some of the new developments in evidence-based policy. One of those was the development of the Academy of Experimental Criminology that elects members as fellows who have completed experimental designs and in the field in criminal justice areas. And so there's a whole list of colleagues who have been elected fellows. We also give an award every year for the Joan McCord Award for a person to speak at ASC. And also we do Youthful Scholars, and our own Todd Armstrong and Gayleen Armstrong were winners, was it last year? 2 years ago. So it's a great honor, and I just say this because it's also, sometimes people aren't aware of the types of studies that everyone's done, so everybody can nominate people for these awards or to be members of the Academy. So if you know of someone that's done a field experiment in a criminal justice area, please nominate them or let me know who they are so we can have that information. And it has also built a network of people that are not necessarily in the field of criminal justice. So one of the fellows in this organization is David Olds, who's done the nurse-family partnerships. I don't know if you're aware of those, but there's actually a large amount of money that's going to be put into these nurse-family partnerships. And many of us in criminal justice might not have been aware of his work, except through this academy. The other, I'll skip down to the bottom, is the Campbell collaboration with the website. They do meta-analyses and publish them on the website. You can download that information. It's really a wonderful place to start if you want a literature review of some topic. You can go there. There's not a large number of meta-analyses that are published there, but if you can find one on the topic you're interested in, it's extremely valuable. It describes exactly what they've done and outcomes in a way that would be readable. The summaries are readable for policymakers. So it's designed to be a site that policymaker could go to and say, is this effective? but it also includes all the details of the analysis for the researchers. So I find it very valuable. And then our very new division of experimental criminology. We just started, ASC has divisions, and Gayleen talked about the division on corrections and sentencing. Well, we've started a new division, and the board, the ASC board, has agreed that we can have a division of experimental criminology. So we'll be involved in trying to get that off the ground, and could use help. If anybody's interested, come to the meeting at ASC. But it's another, all of these are ways to emphasize the need for stronger, higher quality research in the field, and to emphasize the importance of doing more field experiments. I guess I went through this, the fellows for the Academy Division. Oh, I didn't realize I had these slides. Okay, we'll have our first meeting of the division in Philadelphia this year. And then the Campbell collaboration. So, short summary, I'm essentially rejecting Martinson's nothing works, saying yes, there are things that work. Those things that work are rehabilitation and human service that bring about cognitive transformation or some change within the individual, not just the opportunities in the field. And there's strong implications for the way to develop reentry programs and to think about reintegration. So I thank you, and I think it'll be a good time to take questions. This is my contact information if anybody wants to get in touch with me.
Before we start questions, in the event that there are students who need to go to another class, I know some undergraduate students might be attending, please take this opportunity to speak out. You've gotten credit. And also, I would ask that if you are asking questions, try to shout them out so that they might get picked up by our external microphone, because we are videoing this. But if not, I've asked Dr. MacKenzie to kind of restate your questions so that they will be recorded forever and we'll know what we're talking about going forward. Questions? I'm going to start off with one, if you don't mind. I'm curious how consistent your definitions of recidivism were from one study to another when you're evaluating what works and what doesn't work. What is the recidivism measure you were using?
We used recidivism as measured by arrests, reincarceration, convictions, and also self-report recidivism. When I talk about a meta-analysis, I should say a series of meta-analyses, because I've learned this work, I have to say, from David Wilson, who's an expert in this area. And when we run these analyses, we do a series of meta-analyses. We look at, first of all, and this is one of the methods, what is the outcome? If we look at just arrests as an outcome, are the results the same as when we look at reincarcerations or reconvictions? So we ask that question in the analysis. We also ask, is it, if we use just 12 months or less, do we get the same results as if we use all the data? Can we pool the data, and are those results the same as when we look at different measures? Some of the difficulty is that some areas, like sex offender treatment, have a high number of studies using self-report outcomes. And we know that the outcome then is a very different measure than official records. So some questions are difficult to ask and compare because you have these differences. But it is something we examine in all the meta-analyses.
George?
I was just curious, on the list of programs here that didn't work, you listed juvenile residential programs. When the studies that you listed, is it just the mere incarceration of the juveniles, or a combination of the incarceration and the programs that were inherent in different treatment or the different facilities?
Right, good question. We looked at an assortment of programs. Oh, summarize that. He wants to know when we looked at the juvenile programs, the residential programs, we said they were not effective, but were we looking at different types of programs within the facilities, and what did we mean by just residential facilities? And that's a problem. These were programs that were really putting juveniles in some kind of specialized program. So it might be a wilderness program compared to another type of incarceration. And so overall they weren't effective, but we examined separately cognitive skills programs. So if cognitive skills was offered in a juvenile facility, it was effective compared to those that didn't get the program. And so boot camps, we looked at juveniles and adults, and again, that was not effective. I mean, juveniles in boot camps compared to juveniles in other types of facilities, it did not make a difference. So that characterization of juvenile residential programs is broad and very generic programs without a clear focus. Following up on that work, there's a meta-analysis on therapeutic wilderness programs for juveniles. Juveniles sent to therapeutic wilderness programs that have an enhanced therapeutic component and also experiential learning during the wilderness part. So there was experiential learning in often challenge activities like an Outward Bound versus juveniles in a traditional facility, and they did find in that meta-analysis a significant difference. So I think it's juvenile residential facilities you really have to start looking in more detail about what's offered in the programs.
As a follow-up to that, I was going to ask sort of the same thing with respect to intensive supervision. That when you say intensive supervision, you're simply referring to the close monitoring, sort of check off, have you paid your restitution, have you shown up, and not the sort of cognitive-based interviewing that occurs with smaller caseloads and intensive supervision, along with sort of, I guess, a more personalized approach between the officer and the probation.
Most of the studies that were done, I'm sorry, she's asking about a similar question. What about differences in the intensive supervision programs? There are intensive supervision programs that are just focusing on checking off boxes and urine testing and meeting more frequently. And then there are programs that really do enhanced kind of treatment and therapy. These programs, the evaluations were done for the increased amount of supervision. Of course, Peter Cilia's work with many different sites really focused on, yes, they were more intensively supervised. They had to show up more, they had to take drug treatment. So by intensive, it was the amount of control and requirements. Then when you try to look at this group of studies and say, what about the treatment components? There's much less information given about the treatment components. So my feeling would be to then turn to the other programs that were effective, looking at cognitive skills training, drug treatment. So to the degree that they incorporate those, they may be effective, but the research really hasn't been done and hasn't included enough. Some preliminary research by Peter Cilia did suggest that if they had a focus on drug treatment, they were more effective. But
And with respect to sex offenders in particular, are there any studies that show that intensive supervision standing alone may not have much impact on recidivism, but also just cognitive behavioral therapy may not be that effective as well? That what seems to work with sex offenders, I think, oftentimes is the three-cornered stool, the accountability with your meeting with your officer, the intensive supervision, and the therapy working all together.
The question was on sex offenders, a similar thing. What is actually being offered to them? It's not just the cognitive therapy, but also if they're following them up with treatment combined with intensive monitoring treatment. And to my knowledge, those questions haven't really been explored.
My question deals with how do you deal with politicians who are out there saying incorrect information and they're implementing policies that go diametrically opposed to research. I was living in Georgia when one of your studies came out that said Georgia's militaristic boot camp didn't work. And our governor, Zell Miller,
I met him actually, yes.
who later became senator, was quoted on the front page of the New York Times saying that he didn't give a damn what these researchers said. He went to boot camp with the Marines and it changed his life. So these kids in Georgia were going to continue these boot camps regardless of what the researchers said.
And that has I mean, that was one of the continual experiences I had with the boot camps was hearing people say that. I'm not looking at the results, and that's when I start to emphasize the science and say, well, you have a belief in science. Would you take a medical treatment that hadn't been really examined with high quality science? Then why are you telling me you know more in this area? So if they're coming down, I mean, sometimes they're saying, I can't afford to do that, and that's a different issue. Or the public won't accept that. That's a different issue. But if they're saying, oh, I believe they work, then I say, if you don't, it's very hard to argue with that. All you can say is, I've done the science, and it has happened to me many times to try to debate. But back to Georgia, actually, the Secretary of the Department of Corrections, and I forget his name at that time, or he came in soon thereafter, they actually did put treatment because they were the boot camp that had no treatment in the daily schedule of activities, and they did change and put some treatment into their boot camps. So maybe baby steps.
Maybe better the effectiveness of any correctional programs. I think not only the measure of recidivism, but also the period of follow-up is very important factors that can affect on the recidivism rate. So according to the previous studies, they used a lot of those different measures on the follow-up period to measure the recidivism rate. How did you accommodate those differences in previous studies to be able to make a judgment in your study?
In the study about differences in follow-up time, and essentially the question was, how do you accommodate when you do a meta-analysis? How do you study all those differences among studies? In other words, studies, as I said before, some use the outcome of recidivism as arrest, some use reincarceration, some use reconviction, some use self-report, some follow people up 6 months, some follow people up 12 months. Were there other issues that, yeah. And so that's why I say a meta-analysis is not one meta-analysis. A well-done meta-analysis is a series of meta-analysis asking questions about this. In other words, if we only look at studies that followed up 6 months, or any study that gave us the data up to 6 months, do we find differences? Well, of course, many times you do not find differences if they're only following people up a short period of time. There's not enough time for them to be arrested. So if you look at only studies that followed them up to 12 months, do you find differences? Or then if you find studies take every study that followed them up for 24 months. And of course, with sex offender treatment, it can be years. You're talking about self-report 5 to 10 years of follow-up data sometimes. So you break it down into a series of meta-analyses and ask, do we get the same results if we run the meta-analysis with these different components? And so when I'm giving overall, I'm kind of giving an overall, this program looks like it works, but then we could go into the details of, gee, if you only follow them up 6 months, it doesn't work, and you know, there would be, so this is the best summary of overall those meta-analyses.
Yeah, I have been, this has been struggled with. I've struggled for many years about new research. An example, once I was in Wachovia County in Salisbury on the issue of Maryland.
Yeah.
To study about the sheriff department. So the sheriff was there for 25 years, and he knew his ground very well. And I was there for total quality management. But the sheriff brought me to a boot camp, which was closed. And he said that he opened that boot camp. The only purpose he had in his mind was $70 per student per day. And he calculated if he put 300 in the boot camp from state of Maryland, mainly from Philadelphia, he could make millions. Then a videotape revealed there was a violent something. So the lieutenant governor Townsend from Kennedy family shut that down. So if we study about that kind of program, but the purpose of that program is irrational. Just like, only for money, I don't care about effectiveness. But we use all scientific methods. Say, we use this rigorous science method. We use that method to study a program, but the purpose of that program was not for science at all. How can you read science? I have the same problem myself.
Right. The problem is the issue of the goals of the program. There are various goals that people have for programs, and this example was a boot camp where the sheriff wanted to make money. His goal was to make money. He wasn't interested in the science of effectiveness and having an impact on recidivism. He wanted to make money. Well, from one direction, you could really, an economist could go in and say, yes, you can make money. That's not my interest in the programming. The other thing, and boot camps get to be very controversial with the different goals, because one of the goals might be to get people out, and it is in New York State, to get people out of prison early. So they had the Rockefeller drug laws that sent relatively minor drug offenders into prison for a long period of time. Well, the legislature let them make a change that if the people went through what they called the shock program, which was a boot camp program, they could be released early. And the state, so the goal was in part to save a lot of money, but for those that believed that the sentences were too long, to get them out early. And so that's why I say I look at recidivism, because they get it mixed up then. They start focusing on the goal of getting people out early, and they're just kind of assuming, or they're not doing the science to say recidivism. So that may be their goal, and that may be a perfectly legitimate goal. And I'm willing to accept they can do the financial analysis. Not me, I'm not gonna do that, they can. And if that's what they want, then to get them out early and save money, that's fine. But they then often slip in, oh yes, and it reduces recidivism. And at that point I say, well, you need to know that, if that's one of your goals. So often when I would start, particularly the boot camp work when I first started it, I would go to the administrators and say, well, what are your goals? What exactly do you expect to accomplish with the program? And then try to study the different areas that they expect to accomplish. And you can study costs from an economic point of view, scientifically, I suppose, but it's not a perspective of treatment and rehabilitation and impact on recidivism.
I guess your study show that cognitive transformation is one of the most effective ways to accomplish what we want to accomplish within society. A two-part question. The first part is, how is cognitive transformation best achieved? Secondly, do we have enough of those studies to say that now, as a policy, corrections money for rehabilitation and all that should be pulled more in this direction than in the other directions.
Oh, all right. So the question was, according to my findings, cognitive transformation is what we need to bring about changes and improve society. And how, the two parts.
The second part is there enough there for us to be able to say that this is where our money should be spent?
Should we spend our money in this area? Is there enough there to argue that that's where we should spend our money? I think there's enough support to say that we should spend our money there. I would argue that we might be able to reduce the length of sentences and increase the money for treatment or keep people out. And many states are considering keeping people out by putting them on probation or releasing them early. And what I'm saying, take some of that money and develop these programs so that we indeed can try to keep them out. I think there's enough evidence to say, yes, it's worth our time and money to go this direction, and that we should. But of course, when we deinstitutionalized the mental health population, we didn't really give them this treatment and coverage that they needed out in the community. So that's the worry, is that we get them out, we keep them out of prison, we let them out early, but we're not doing the programming. And I would argue there's enough evidence to support doing programming, using some of that money to do programming. I'm not sure the politicians are going to listen to me, but.
I was just wondering, I don't know for sure, but all the economic reasoning, do you know where most of the money was, what programs most of the money was going to? What programs was most of the money going to? The reentry money or the? My feeling, looking at some of the first studies that have come out on reentry, is that a lot of the money is going for employment services, connecting people with jobs, giving them employment skills to look for jobs, computers to look for jobs, and that's why I'm concerned. I think those are, they need those opportunities also. But what worries me is that if we don't do the other changes first, I think there's enough evidence to say, you got to get them ready to get out of bed in the morning and not party all night the night before, so they see a job as something they want and can gain the things they want by showing up for work. And so that was just my concern, that we've moved too far in this, let's give them opportunities.
When you talk about the individual transformation that has to occur first before the individual can take advantage of the environment, is that similar to someone being amenable to treatment? Is that what you're referring to? I'm thinking of what we used to term in the field when somebody hits bottom. Is that something totally different?
The question had to do with, when you're talking about cognitive transformation, are you talking about somebody amenable to treatment, or are you talking about readiness for treatment? No, I think that's a whole area that I have not explored that is important in considering the transformation. In other words, I'm saying these programs seem to be creating a transformation, a major change in their thinking and their willingness. But I think there's very limited information about the readiness for treatment and how you get them in the first step before you put them in these programs.
As an old probation officer, I'm thinking about what you said, what I've seen happen over the last 20 years or so, where to develop sanctions, the departments and state courts looked for residential placements for folks, but it sounds like that may not be as effective as just good old-fashioned lower caseloads with emphasis
Okay, the question is, how do you combine? It sounds like the programs that are effective could be offered in the, well, are things that are offered in the community, and that it would be more feasible to give those programs instead of putting them in a residential facility. The problem then becomes, how do you make them go to those programs? And well, one of the things, a lot of the research, though, that I'm talking about has been done in prisons. So it's education programs in prison. So it's actually, many of the programs can be offered in residential facilities. But I think we've got a major problem if we're going to try to keep people out and get them in. How do we get them to go to the programs and insist they go? Can we use readiness to help us make that decision? Can we use much reduced residential time to present, to give them these programs? It's much cheaper. I'd like to keep them out, but in some cases, maybe they can't. One of the things I think that we can learn from the drug courts is that they have such a strong stick. Because the person has to come to the court can say, all right, you're in a jail for an overnight or a short period of time, or I'm sending you to a residential drug treatment because you can't seem to get your drug treatment under control. You're not showing up for the program. But it's swift, sure response to misbehavior. Whereas in the probation office, and you're the expert on this, but it seems to me that there's all these procedures. So the probation agent is checking off, person didn't show up. Treatment people aren't necessarily telling probation agent, person didn't show up. So getting all the information, acting on that information, delays things and causes problems. We're in the drug court with everybody working together in the court. They respond faster to the person's needs. So I think that's a model that I know they've tried to use in mental health courts and others, and it doesn't appear to be as effective. I don't think the research is there yet, but they haven't had the same kind of success, is my understanding.
I'm going to exercise the prerogative of the chair after I let Holly ask a question.
Thank you, Dennis. Could you operationalize cognitive transformation for us?
I've thought about that. Really good question. One of the ways we might do it is, oh, I'm sorry. Can you operationalize cognitive transformation? So she wants to say, how are we going to measure this? What exactly do we mean? One of the things may be the antisocial attitudes that have been, that may be one way. It seems to me that doesn't really, isn't broad enough to cover the education and drug treatment. So, but there are many scales that would measure antisocial attitudes, and that would reflect a part of this cognitive transformation, that you would see a change. So you would measure with a scale and then see a change in their attitudes or thinking. So any of the scales that are used for those kinds of things. But I don't think we have exactly the scales that would measure it. I think that we should improve on trying to measure that.
So you're really kind of talking about a package of cognitive changes.
Yes, yes. And I would go to the Gendreau and Cullen kind of philosophy of what is the need, the person of need. So essentially the readiness issue, are they ready for change? What is their specific need that is directly related to their criminal behavior? How do we measure that? And then measure changes after the program.
Okay, now I'm exercising the prerogative of the chair with maybe the last question. And I'd like you to, first I want to footnote, if you look at Lipton, Martinson, and Wilkes, the book, not the article, they start off by saying the quality of research that we've examined is so poor, we really can't tell whether anything works or not. However, they then started talking about some things that might, which is where Martinson perhaps stepped out too far. So first, I want you to maybe talk a little bit about the ethics of overstating the results of research as Martinson did and the consequences for him. But then secondly, when I was looking at your slide, it looked to me like there are some things that appear, not only do they not work, but they may be creating more of a problem. The people on the far left side, and in fact what we're doing is causing greater recidivism than preventing recidivism. And so the twofold question. What do we as a profession do when a researcher overstates her findings? And what obligations do we have? And then secondly, are you looking at anything that might actually be iatrogenic, causing more crime as we try to intervene?
Okay. So did you get that question? I think the first with Martinson, and I think in their work and even in his article, he made it very clear that the implementation of the programs were so poor. Implementation was so poor. They didn't see the therapist enough. They didn't get enough dosage to really expect the program to make a difference. And then also the studies were so poor that it would be hard to tell if it worked or not. So I think that they did make that very clear, but I think the public, as Cullen and colleagues have discussed, the kind of times were ripe for a change, and this was something, a mantra they could hang on the science at this point that nothing works, although he was more cautious in saying that. So that, I think that but the danger of how the public interprets studies is always fearful, and when we worked on this, what works, it was terribly difficult to try to come down with this list, because we all know, as I said, when I got to the different studies, well, this is updated, and the multi-systemic therapy, I caution you, I'm saying it's effective according to my work at that point in time when I finished it, but follow-up work would suggest that it's not as successful, that there's no difference between groups. So if you're thinking of that program, be cautious. So I tried to update. Now, as far as creating problems, the first thing that comes to mind is the Scared Straight program, where people are taken into prison, and lifers. This started in New Jersey. The children, juveniles, at-risk juveniles, are taken into facilities, and the lifers start yelling at them, scaring them, telling them how terrible prison is and what's going to happen to them if they get into prison. And of course, the research on Scared Straight has shown that those children that had Scared Straight actually had higher recidivism. So from that point of view, some of this is fearful that we will have a negative effect. Most of the research I've seen, though, has not. It's more a no difference, like the boot camps. It's no difference. Not really an impact of getting worse because of the program. In other words, many of our programs don't do anything. The other issue, though, related to the decision making that I think is important is the work of Todd Clear in communities, that this locking up so many people and taking such a large percent of people out of inner urban city environments has actually increased crime in the community by the negative effect it has on the community, the vision of the children, the lack of care, because many of these people that we put in prison they are not completely antisocial. They're performing sometimes quite well in being there as a father for children. Once they're in prison, that role changes, so that we've destroyed inner city communities and actually increased them through generations, or by limiting the opportunities for the people returned from prison or juvenile institutions. They're back in the community, they have little in the way of opportunities, and
little knowledge about how to do things, and so they stay back, continuing crime.
Thank you. We're going to take a brief break, and then doctoral students and agency people are going to reconvene in the flag room. Let us all welcome and thank Dr. MacKenzie.